Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is with you, and we are discussing a very important infectious disease, mumps. And the meaning of this word in Latin is a kind of making the face. It is basically sides of the face, so it gives a new shape to the face. So I think that is the real context of this. And the story goes in 1963 when a doctor uh, in USA, her daughter suffered from a swelling in the neck, and he took some tissue or some saliva, and ultimately this mumps virus was discovered and vaccine was developed from that kind of material, and then it was mixed with the MMR vaccine, and we will further elaborate in the presentation. Later I should share the presentation with you, and after sharing we can move to the presentation side if it is easy. That I should take the look. Yep. So it is okay, and you can see the first slide shows that the child you can see, and the doctor is inside, and he is the father, perhaps. And let us see the mumps virus and its vaccine as well as the other areas. And here you can see that the mumps is basically a unilateral or bilateral. And here in this picture, you can see that it affects the parotid gland, and the swollen parotid gland is actually the word used for the mumps, and that gives an aesthetic bad look, as well as it is a painful, and it has a fever and other flu-like symptoms, and it has very serious complications, which we will discuss. So this is the MMR vaccine. We will go to the history of the vaccine, and you can see that this is the basically the development of the vaccine in 1963. Uh, 5-year-old daughter caught the mumps, and significantly, and here you can see the picture of the Dr. Hellman, and perhaps the middle is the daughter, and as he first invented or worked on this, and he has almost developed more than half dozen of the vaccines, and it is said that here you can see that the contribution impact is legacy. Hellman developed over 40 vaccines, not half a dozen, but 40 vaccine in his career, including 8 of the 14 routinely recommended for the children. And the impact is his work is credited with saving more lives than any other scientist in the 20th century. So it is a record breaking, and Dr. Maurice Hellman, I think, deserves the appreciation and applause for this public health service. And here you can see the picture is that how mumps vaccine, mumps and rubella vaccine is combined. And in Pakistan, we are giving measles and rubella and sometime MMR vaccine, but routinely the rubella is a serious disease causing a lot of complications in the children. So this is one of the poster, but not showing the mumps vaccine. And let us move further. So, doctor, incubation period is 12 to 25 days, more common in late winter and spring, outbreaks in school, colleges, and orphans. So, this is another uh, Prevention, isolation 5 days after gland swelling, and hygiene, avoid sharing utensil given as a MMR vaccine, live attenuated vaccine, first dose 12 months to 15 months, second 4 to 6 years, and third dose during the outbreak. And the specific country guidelines can also be seen, and the protection of the two dose is 88%. And this picture shows that infectious by a virus that easily spreads through saliva and mucus. It usually happens in kids who haven't been vaccinated. So, how you will diagnose? Clinical diagnosis: parotitis means swelling or inflammation of the parotid gland or the sides of the neck from the below the pinna of the ear and up to the mandible. PCR is another, and serum IM antibodies against mumps and elevated serum amylase. No specific treatment, supportive treatment, rest, fluid, analgesic, cold if it is high temperature, and clinical features. Fever is there, headache, malaise, painful parotid swelling, that is important. Earache, complications, architis, post-pubertal males, uveitis in female, aseptic meningitis, pancreatitis. Pancreatitis is also very painful condition, and rarely there is deafness. So the transmission is cough and sneezing, direct contact, sharing utensils, infectious 2 days before uh, it becomes. So epidemiology, I have already mentioned. Incubation period is 12 to 15 days, more common in late winter and spring, outbreaks in school, colleges, and orphans. So once again, you can see that this is the virus and its epidemiology, prevention, and the history of the vaccine. The dose is 0.5 cc, 0.5 ml, and you can give even through the injection. And nowadays, the micro array patches are MAP patches, and micro needle patches MNP are also under research and trial in Gambia and other countries. They have shown the successful. It will reduce the cold chain problem as well as it will reduce the fear of the injection and the painful procedure. So all these things will improve. Normally, the question can be asked that what is the vaccine for mumps? It is MMR vaccine. Which gland is affected? It is parotid gland. And how much is the protection with the vaccine? 88%. Incubation period 12 to 15 days. Complications. What are important complications? Architis, uveitis, meningitis, and pancreatitis. These are the important. And a person will need no hospitalization, but in emergency, it is an acute disease, so you will have a consultation with the local doctor. And nowadays, telemedicine is there. You can send the photo and you can contact with your family physician, and that can be, I think, an important primary health care available there. So once again, we are ending this meeting, and I hope the students of the MBBS, MPH, MSPH, and other courses will like this video and find useful content. Please like it, share it, and if you have any query, please drop in the comments box. And once again, I think this is an important public health problem. And in Pakistan, the patients are there, and even the world globally, this problem is there. So if the immunity is less, then this can be a problem. It is a RNA virus, and it is one of the important public health viral disease. So you have to take care of this disease because it affects the children and it affects the life or the future generation as it causes infertility, arthritis, and architis. Thank you very much. And with this, I think we are ending this uh, meeting, and you will find that the video will give you latest information on other topics. Before it, we have made the rubella video as well as video on the measles and other important topics of the public health and community medicine. I am fellow of College of Physician Surgeon, which is one of the center of excellence and prestigious medical institution in Pakistan. Thank you.